Right. We will continue from question number 21 in 2001 paper. The question is true or false about promethazine. Promethazine is an antihistamine. Question A is, it is effective in relieving pruritus caused by allergic skin rashes. That is true. A is true. And there is some more description about this drug. It is given for nausea and vomiting. It is given for allergies. It has injection form also. So it blocks H1, that is histamine 1 receptors. Not given for children younger than 2 years because it causes severe drowsiness. So because of the side effects, not given for children below 2 years of age. So part B, it has bronchodilator properties. That is false. It is only an antihistamine, not a bronchodilator. C, it is known to cause drowsiness. It causes drowsiness. D, it is effective in reducing diarrhea. That is false. It is effective treating motion sickness. That is true. For motion sickness, they first try this with this drug. Question number 22. True or false of vaccines. Now, BCG vaccine is administered at birth. That is true. Before the baby leave the hospital, they give the BCG vaccine. BCG means Bacillus calmette-guerin. That is given for tuberculosis, to prevent tuberculosis. Okay, we'll go to B. Measles vaccine is recommended to be stored in the freezer compartment of the refrigerator. That is false. Measles vaccine is stored between 2 and 8. It is a live vaccine. Oral polio vaccine is live attenuated vaccine. That is true. Attenuated means the ability to cause illness, or it is called virulence, is reduced. So it cannot cause disease, but the oral polio vaccine, the virus multiplies inside the body and it gives a good immunity. But normally they give 3 doses. Here is some description about live attenuated vaccine here. They use the original, that is called wild virus, and take attenuated in the laboratory. The virus strength is weakened. Then after immunization, the attenuated virus or attenuated bacteria start replicating, that is multiply, increase in number. So it gives a better immunity because live vaccine gives a better immunity because the organism we introduce into the body starts multiplying. So if you give one bacteria, it may produce another thousands of bacteria. So here virus also same. It does not cause disease. Only thing, where this is also common question. You cannot give live vaccine, live virus or live bacteria to immunocompromised people. Immunocompromised means their immune system has gone down. So they cannot fight with and other germs. So those people are, one group is cancer people or HIV infected people, then leukemia, patients with leukemia. Those people have reduced immune system. So they can get a different, even attenuated vaccine can cause them disease. So these are live attenuated vaccines: BCG, rotavirus, chickenpox, measles, mumps, and rubella vaccines. They are live vaccines. So there are inactivated vaccines, that is dead bacteria or dead virus. They cannot no more multiply. They are killed vaccines. They can be given to immunosuppressed people, people who have impaired immune system can get these killed vaccines because the germ is not no more living. Inactivated vaccines or these killed vaccines need multiple doses, 2 or 3 doses. Now, hepatitis A or influenza, polio, they are inactivated vaccines. Sometimes you get not the whole bacteria or the whole virus, parts of them. So hepatitis B vaccine is only a part of the virus. So they are here. Now, pneumococcal vaccine, this is also an exam question. Pneumococcal vaccine is a polysaccharide vaccine prepared by polysaccharide cover of the bacteria. The bacteria has a polysaccharide cover. Now, bacteria causing pneumonia is like this. It's a diplococci. That is called pneumococci. This bacteria, there are two bacteria here, and it is covered with a polysaccharide layer around it. This polysaccharide layer is extracted and given as vaccine. So the antibodies are produced against this layer, not to the real bacteria, but the antibodies destroy polysaccharide layer, then the bacteria cannot survive. Then toxoid. I think you know about toxoid. Toxoids are the toxins, inactivated toxins. It is not the real bacteria. toxins are produced by bacteria. So they take bacterial toxins. Toxins are inactivated in the laboratory to toxoids. Now they are called toxoids. This is inactivation. One process is treatment with formalin. So toxin become toxoids. Toxins are poisonous. These are not poisonous. So the virulence is gone. So this make antibodies, produce antibodies and put ABS by both these. Produce antibodies by both. So toxoid is given as injection. So patients get immunized. So that is diphtheria, tetanus are the most common toxoids. Polysaccharide vaccines, that is what I said. So remember two examples. One is Streptococcus pneumoniae, that is pneumococcus. There is another one, Haemophilus influenzae, Haemophilus HIV vaccine. So conjugate vaccines, you get more than one vaccine together. Then the last part is recombinant vaccine. Recombinant vaccine are always prepared using bacteria or fungi. Not all fungi, yeast cells are used. So yeast cells or bacteria. Bacteria, common bacteria is E. coli. In recombinant technology, they use E. coli is a bacteria or yeast. So if E. coli has a circular DNA. What happens is if you want to make a vaccine for a part of it, then the gene is taken from the another source, that is the bacteria or otherwise the germ. What we here is gene segment from the protein is taken and included in the bacterial gene. So bacteria multiplies very fast to produce. Yeah, for example, even insulin is produced. See now, human gene is useful. So the examples are growth hormone, insulin. They are not vaccines, but they are also produced the same way. Yeast or E. coli. That is called recombinant technology. D. All vaccines should be transported to the field in chilled and insulated containers. That is true because to maintain the cold chain. from the production up to the user, the temperature should be maintained at the low level. True or false regarding corticosteroids? Question A, hydrocortisone is preferable to prednisolone when used as replacement therapy. That is false. Hydrocortisone has a lower action as a it is in action. Hydrocortisone is more antihistamine action, not as prednisolone, no corticosteroid action. Budesonide is effective in the long-term prevention of asthma. That is true. This is a steroid. This is a steroid structure. Normally given above 6 years old patients or higher. It is used for as a suspension, liquid suspension for younger children. It is a corticosteroid. C, hydrocortisone is more effective than adrenaline in reversing the symptoms of anaphylactic shock. So in anaphylactic shock, the two main things are bronchoconstriction, that is in lungs, the airways are constricted. Constricted means it is narrowed down. So other problem is vasodilation. Blood vessels become bigger. That is called dilation. So the treatment should be given to reverse this action immediately. So adrenaline is a vasoconstrictor. Adrenaline constricts the blood vessels. Also, adrenaline is a bronchodilator. It dilates the airways, so easy to breathe. So adrenaline is fast acting in anaphylactic shock, not hydrocortisone. So the answer is false for C. After adrenaline, hydrocortisone follow up because to prevent allergy conditions. Because this hypersensitivity action coming as allergy, coming as anaphylactic shock. This is called type 1 hypersensitivity. Anaphylactic shock need to be immediately treated with adrenaline. T, topical fluorinated steroids do not get absorbed into the systemic circulation. That is false. They are absorbed to the system. Oral prednisolone referred to inhale steroids in the prevention of asthma. The oral prednisolone, when you give orally, it is a dose in milligrams, but inhalation gives in micrograms. So very much lower dose in inhalation. So the side effects are very much low. Prednisolone has a lot of side effects. So prednisolone steroid inhalation is referred to the oral therapy to avoid the side effects. Then other question is about worm treatment. Question number 24, true or false regarding drug treatment of parasitic diseases. Mebendazole is a broad spectrum anti-helminth drug. That is true. What does it mean, broad spectrum? That means it works for a wider range of parasites. That means many parasites. So mebendazole, action of mebendazole is against many nematodes in the stomach. Sorry, intestinal tract. Mebendazole kills Ascaris lumbricoides. These are the ones. It kills Ascaris. It kills and Xylostoma duodenale is hookworm. This is also another type of hookworm, Necata americanus. Trichiurus trichiura, it kills Trichiurus trichiura. Then filarial parasites, no, not here. It is a blood parasite. So there are other tapeworms and so many other types of worms, threadworm. So all these are eliminated with mebendazole. So that is the answer is true. Question B is diethyl carbamazine citrate is the drug of choice in treatment of filariasis. That is true. Earlier it came as a heterosan, original drug. Now there are generics. Diethyl carbamazine citrate, DCE, is a treatment for filariasis. This is the result of filariasis when it is not treated at the very early stage. The filaria worm stagnate in the lymph node, and after that it start producing small pillows microfilaria. This is the life cycle, just to know it. Mosquito is the vector. So from human beings, mosquito through a mosquito bite, normally in the midnight, these parasites come into the blood of humans. Then the mosquito takes a microfilaria. These are small parasites. Then this microfilaria grows in the lymph nodes. Adults, male and female worms are there. So they start producing another microfilaria, small larvae, and mosquito takes this one, and in the mosquito it grows, and finally mosquito become infective, can infect another human being. So microfilaria is the one circulating in the blood of the man. Adult worms are in the leg. That is why this leg is becoming this state, because adult worms you can't remove with drugs once this is it is in the this state, because it is the obstruction of lymph nodes. So the lymphatic tissue will get enlarged, and that is called elephantitis. So metronidazole is effective against whipworm infection. No. Metronidazole is anti-protozoal drug. It is effective against protozoa. Mebendazole 100 milligram as a single dose and repeated 10 days later is effective in eradicating threadworm. Mebendazole has 100 milligram tablets and 500 milligram tablets. 500 milligram tablet is the one single dose. You don't have to take any more. But when you take 100 milligram tablets, you have to take one tablet BD, morning one, evening one, for 3 days. Now, for threadworm, one single 100 milligram tablet is enough. One single 100 milligram tablet is enough for threadworm infection, that is Enterobius vermicularis infection. Then the worm is also called pinworm. And 10 days later, repeated dose is given because the larvae will not be killed with the dose, one dose. So in 10 days, the larvae has become adult worms, and that generation is also gone with the second dose after 10 days. Sometimes you have to give after 21 days if it is not eradicated properly. So number 25, true or false about oral hypoglycemic drugs. Chlorpromamide is usually given once daily. That is true. Antihistamine action. So B, metformin commonly causes anorexia and vomiting. That is the side effects of metformin. If chlorpromamide is prescribed, the patient should be asked to take the regular meals. So yes, chlorpromamide is a sulfonylurea drug. All sulfonylurea will release more insulin from pancreatic cells. So then what happens is blood sugar goes down quickly. Now, metformin does not release insulin, but chlorpromamide or any other sulfonylurea will release a large quantity of insulin at a time. So the blood sugar may go down. So you have to take regular meals because of that. Patients on oral hypoglycemic drugs should be asked to take regular meals. It's the same thing. Now this one I have put false because when you take metformin, this rule is not there. Metformin never reduces the blood sugar. So not for all drugs, but for all sulfonylurea, when you take, you have to take regular meals. Or when you are taking insulin, also the same rule. E, oral hypoglycemic drugs should not be used to manage diabetes during pregnancy. This one is 2001 paper. So that at that time, metformin was not given for pregnant women. Now they are giving. So I have left it without any answer. It is, if you get this question now, you have to say yes. True. Okay. We will do the next one next time. Thank you.